Healthcare, of course. Without access to proper medical treatment, America would be at a great loss. Unfortunately, thousands and thousands of people go without healthcare every year. It's important to know about this vast system, especially in this day and age when all the media news on the television. Healthcare is essential because it provides several jobs and professions, social security, and coverage programs, and plays a huge role in our economic expenditure. Not only does healthcare save lives, but also provides several occupations. Healthcare is responsible for providing many jobs in America. The United States Department of Labor website and the Bureau of Labor Statistics states that in 2006, healthcare provided 14 million jobs, 13.6 million jobs for wage and salary workers, and 438,000 jobs for the self-employed. Healthcarejobs.org and the Department of Labor predicts a 30.3% increase in the amount of healthcare jobs between now and 2014. 7 out of the 20 fastest growing jobs are healthcare related, and healthcare will create 3 million new wage and salary jobs between 2006 and 2016. There are several different kinds of jobs. 42% are ambulatory healthcare services, 34.8% are hospitals, and 23% nursing and residential care facilities. The minor jobs underneath these include office physicians, home health care, office of dentists and other practitioners, outpatient care centers, medical and diagnostic laboratories, general medical and surgical hospitals, nursing care, community care for the elderly, and residential mental health. So not only is healthcare important for employment, but also for social aid and coverage. Healthcare provides many social security and health coverage programs. Social Security was first established in 1935 by President Franklin Delano Roosevelt during the Great Depression. In 1939, Social Security was made available to retired workers, families, and in 1956 to workers with disabilities. The types of Social Security include retirement, disability, dependent, and survivor coverage. The different types of workers' insurance include self-employed before 1951, federal government, state and local government, nonprofit organization workers, military members, household, and farm workers. According to Attorney Joseph Matthews in the Encyclopedia of Social Security, Medicare, and Government Pensions, 30 million people receive Social Security retirement, 5 million survivor benefits, 6 million disabled benefits, and 5 million retiree or disabled worker family benefits. Medicare, Medicaid, and Social Security are essential to the country. Medicare was designed for the poor, Medicare for the elderly, and Social Security for workers. According to George Schultz and the book Keeping Our House in Order, A Guide to Social Security and Healthcare Reform, Social Security accounts for 4% of the gross domestic product, Medicare 6%, and Medicaid 8%. Not only do social programs impact the economy, but the entire healthcare system as a whole. It plays a huge role in America's spending. Anita Ragavan, in an article, Somewhat Socialized Medicine, in Forbes magazine, says that the U.S. spends $7,290 per person per year on healthcare. That's 16% of the gross domestic product. That's $2.2 trillion. On average, $516 per capita spent on health insurance, $890 on out-of-pocket care, and $878 on prescription drugs. There are many sources and distributions for the money spent. According to Mina Sessions' article, Cost of Healthcare, on the Alliance for Health Reform website, 31 cents of each dollar spent goes to hospitals, 31 to professional services, 10 cents to prescription drugs, and 6 cents to nursing home care. 34.4% of the healthcare dollar comes from private health insurance, 19.2% Medicare, 14.7% Medicaid, 12% out-of-pocket, the rest from other private, federal, state, and local insurances. Right here is an example of different places that the healthcare dollar goes to. Consumer services, government payments, insurance industry, and this part is other medical services. And this 10 cents is the cost of medical liability. Right here, it shows how much more the U.S. spends each year, as opposed to Germany, France, Britain, Japan, Canada, the U.S. Or, yeah. This shows the national spending as a percentage of the gross domestic product. It's predicted that by 2025, the gross domestic product will be 25%. It will be 25% of the gross domestic. So not only does healthcare have a big impact on the economy, but for the general public as well. So why is the healthcare system fundamental to the United States? It's the greatest trade in the U.S. that cares and provides for millions, provides several jobs, Social Security and other programs, and has a great impact on the national expenditure.